In total, there are more than 70 major diseases affecting more than 1 billion people worldwide that all look on the surface to be different from one another, but all actually share abnormal angiogenesis as their common denominator. And this realization is allowing us to reconceptualize the way that we actually approach these diseases by controlling angiogenesis. Now, I'm going to focus on cancer because angiogenesis is a hallmark of cancer, every type of cancer. So here we go. This is a tumor, dark, gray, ominous mass growing inside a brain. And under the microscope, you can see hundreds of these brown staining blood vessels, capillaries that are feeding cancer cells, bringing oxygen and nutrients. But cancers don't start out like this. And in fact, cancers don't start out with a blood supply. They start out as small, microscopic nests of cells that can only grow to 1/2 a cubic millimeter in size. That's the tip of a ballpoint pen. Then they can't get any larger because they don't have a blood supply, so they don't have enough oxygen or nutrients. And in fact, we're probably forming these microscopic cancers all the time in our body. Autopsy studies from people who died in car accidents have shown that about 40% of women between the ages of 40 and 50 actually have microscopic cancers in their breasts. About 50% of men in their 50s and 60s have microscopic prostate cancers. And virtually 100% of us, by the time we reach our 70s, will have microscopic cancers growing in our thyroid. Yet without a blood supply, most of these cancers will never become dangerous. Dr. Judah Folkman, who was my mentor and who is the pioneer of the angiogenesis field, once called this cancer without disease. So the body's ability to balance angiogenesis, when it's working properly, prevents blood vessels from feeding cancers. And this turns out to be one of our most important defense mechanisms against cancer. In fact, if you actually block angiogenesis and prevent blood vessels from ever reaching cancer cells, tumors simply can't grow up. But once angiogenesis occurs, cancers can grow exponentially. And this is actually how a cancer goes from being harmless to deadly. Cancer cells mutate, and they gain the ability to release lots of those angiogenic factors, natural fertilizer, that tip the balance in favor of blood vessels invading the cancer. And once those vessels invade the cancer, it can expand, it can invade local tissues, and the same vessels that are feeding tumors allow cancer cells to exit into the circulation as metastases. And unfortunately, this late stage of cancer is the one at which it's most likely to be diagnosed, when angiogenesis is already turned on and cancer cells are growing like wild. So, if angiogenesis is a tipping point between a harmless cancer and a harmful one, then one major part of the angiogenesis revolution is a new approach to treating cancer by cutting off the blood supply. We call this anti-angiogenic therapy, and it's completely different from chemotherapy because it selectively aims at the blood vessels that are feeding the cancers. And we can do this because tumor blood vessels are unlike normal healthy vessels we see in other places of the body. They're abnormal, they're very poorly constructed, and because of that, they're highly vulnerable to treatments that target them. And in fact, when we give cancer patients anti-angiogenic therapy, here, an experimental drug for a glioma, which is a type of a brain tumor, you can see that there are dramatic changes that occur when the tumor is being starved. Here's a woman with a breast cancer being treated with the anti-angiogenic drug called Avastin, which is FDA approved, and you can see that the halo of blood flow disappears after treatment. Now, I've just shown you two very different types of cancer that both responded to anti-angiogenic therapy. So a few years ago, I asked myself, can we take this one step further and treat other cancers, even in other species? So here is a 9-year-old boxer named Milo who had a very aggressive tumor called a malignant neurofibroma growing on his shoulder. It invaded to his lungs. His veterinarian only gave him 3 months to live. So we created a cocktail of anti-angiogenic drugs that could be mixed into his dog food, as well as an anti-angiogenic cream that could be applied on the surface of the tumor. And within a few weeks of treatment, we were able to slow down that cancer's growth such that we were ultimately able to extend Milo's survival to 6 times what the veterinarian had initially predicted, all with a very good quality of life. And we've subsequently treated more than 600 dogs. We have about a 60% response rate.